Hello and welcome. I am Dr. Pavitra Shankar and I recently passed my MD psychiatry exam, so you could call me Dr. Pavitra Shankar MBBS and MD psychiatry, though literally nobody talks that way. But yeah, this is just a way of telling you guys that yes, the adventure, so you could say, is finally over. So here I am, and in this attempt of a video, I would like to share how the 3 years were. So 3 years, for anyone of you who don't know, a PG residency is of 3 years in India, and I did my MD psychiatry from Lady Hardinge Medical College, New Delhi. Also the same college from where I did my MBBS. So when I went into psychiatry, of course, the thing is that I didn't always want it. I only grew a liking for it during my internship, and it was largely something of exclusion, and both of exclusion as well as what suited me. So I did not really like any of the other branches. I knew I wanted to do a clinical branch, but none of the other ones really attracted me as much. And also I think so I've realized that it is important that you have the skills, B, interest, and C, the kind of right aptitude for whatever career or sub career that you're choosing, like a specialization. And I think psychiatry fit in very well into that. And also, like the also important is the number of opportunities that you would have, and of course, all those things, they sort of fit in my case. And yes, I joined MD psychiatry, luckily in the same college as I did my MBBS from, as I've already mentioned. And yeah, I went with literally all the sort of stereotypes that literally everyone has about psychiatry. I had my own set of fears as to would it take a toll on me, would it be dangerous, so to say, would it be something that I regret, would it feel less clinical than any of the other branches that I might have had the chance to choose. So yeah, those were some of the questions that I went in with, but I knew that I did have like the sort of skills for, let's say, the clinical interviews and the MSCs and the long hours that you spend with patients, sitting with them, listening to their histories, etc. I knew that I was interested in all of that. So yeah, I remember my first day. I went with one of my co-PGs, and we met all of the consultants on that day, and everybody had all the good wishes for us, and some of them were quite excited to have us. Maybe that was because हमारे से पहला वाला batch was had not had their juniors for like 1 year, because at that time COVID had delayed NEET PG exam. So we were we were like the much awaited batch, and हमसे पहले वाले seniors had worked as first years for quite a bit of time. But yeah, so first few days were basically just shadowing the seniors, sitting with them, sitting in OPDs, following them around on emergency duties. And honestly, one thing that came as a surprise to me was how shockingly clinical the branch is, and how, while nobody expected it, I had such long hours, especially in the first year. Right off the bat, within like after 1 week, we started having like these long duties, which would technically be only 24 hours. So you would basically, if I go at 9 a.m., I would be required to stay in the hospital till the next day's 4 p.m. So it would close to touch on 36 hours, most of them. And of course, before that, I had, because of COVID and the NEET PG getting delayed, I was not really in the clinical scene for a few months. So that was difficult for sure, but we easily got used to it, because honestly, it is pretty interesting, especially when you see for the first time, you see these crazy emergency duties, and you see the kind of skill set that people who are deep, who are some years into psychiatry have. I was amazed by the sheer patience. Patience is the one word that is. Patience is the one skill rather that is quite important for someone in psychiatry, and I realized this pretty much in the first week of me in residency, because a history taking, b mscs, then any sort of referrals that you get, anything, every time you see a patient, you have to spend like multiple if not hours, then at least minutes with the patient, which is not something we usually do in other branches of psychiatry. So yeah, I came to appreciate that quite early on in residency. So yeah, and then of course it was interesting because you see for the first time in your life, you see these patients who are currently in their manic phases, you see patients who are living with schizophrenia, and you see the, you know, you, because in mbbs we do read about, let's say, psychotic symptoms, we read about delusions, hallucinations, we read about depression and suicidality, but when you actually see it, when you actually see how mental illness affects not just, so it's when I it is amazing to see how mental illness is not just like a group of symptoms, it is something that becomes like a lifestyle. It it has such effects, like not just medical but like social, personal, psychological, at so many levels. And when you when you sit at your clinics and you get a patient, often the complaints in psychiatry are basically behaviors, right? For example, this person has been spending a lot recently, that's a behavior, that's not like I have headache. And how do you go about changing behaviors essentially, and how, and then just the whole science behind it, it was just bloody fascinating. So yes, of course, no regrets there. But yes, it is and obviously it takes you time to get used to the fact that you know, when someone cracks a joke, because just because they don't have the right judgment for it, that you don't laugh along, that there's a certain way that you talk to the patients, there's a certain way that you talk to people with mental illness, that's a skill that you have to learn. And yes, of course, that took some time, but it was really interesting, and something that does help in, like, I think other areas of your life as well. um, Other than that, of course, talking about the academically oriented stuff, mm, so psychiatry surprisingly has a lot to read. No, of course, like every clinical branch, or not just clinical branch, like every subspecialty in medicine has a lot of stuff that you have to go through. But because psychiatry is something which is so it's so deep rooted in, like, not just the medical aspects, but there's so much psychosocial aspects of every illness or every sort of mental health, every mental state. And mental health is what we call something as the psychosocial biopsychosocial model. um, that mental health follows a biopsychosocial model. It is um, you do have to read up not just like the biology, which is, in any ways, if you are a medical person, then you know how difficult and how comprehensive and detailed things like neuroanatomy and neurochemistry and neurobiology is. Then on top of that, you have to learn psychology, which is like a whole new which is like a whole subject. Like, people literally do their specializations and super specializations in psychology itself, and it's something that you have to learn along with your psychiatry. And then you have to learn something called phenomenology, then diagnosis, treatment, and then the social aspects of things, then forensic psychiatry, and a lot. And of course, then there is something called CLP, where you have to read about how medical illnesses, so to say, or physical illnesses, so to say, are related, and how they manifest or how they affect mental illnesses. All of that is there. So yes, it is a lot to learn. But I think first year, if I were to break it down for you, if you're someone who's looking into psychiatry, who has gotten themselves into psychiatry somehow, and if you're confused, I think first year what you do is focus only and only on the clinics, on the psychopathology, on the fish and the Sims, and NC Anderson and all of that good stuff. There is just no shortcut for learning clinical skills, and I think it is one thing that you should really not be going for, because this is the one skill that will ultimately be helpful for you, right? Because at the end of the day, it is true that in psychiatry we do not have a lot of drugs, so to say. We do not have a lot of pharmacological intervention. What we do have is us, and what we say to the patient, and how we talk to the patient, and what the patient is telling us through their symptoms, to what they're saying. And fortunately, unfortunately, because we don't have any sort of imaging that gets into that tells us about diagnosis, you are really the only weapon that you have for diagnosing correctly your patient. And of course, if you were to read about it, it does matter. Even if you're giving the same sort of medications, if you are diagnosing it wrong, it will have repercussions later on. Right, so first is about that. Second year is an opportunity to actually explore things like research, things like are you someone who would want like an academic career? It's something that I realized it's something that I was interested in. So in second year, I wrote quite a bit of research work, got it published, and it is fun. And I realized that I always knew that I liked writing, but then would I also be into scientific writing is something that I explored in second year. Also, so like community psychiatry, doing community health initiatives, would that be something that you're interested in? Second year is a great time to find out. I found out that I was interested in that as well. It's also a great time to find out like what branch of psychiatry, if any, it's not necessary, but then like what kind of patient subset is your area of interest. So for example, there's geriatric psychiatry for the elderly population, there's women and child psychiatry, there's forensic, and there's community psychiatry. I realized that I have like a mix of interest in community psychiatry as well as women and specifically adolescent mental health. It's not necessary to have that interest, but sometimes it is good to know that okay, this is what I'm interested in. And then your future efforts, it does help to have that kind of clarity, because your future, let's say, research work or clinical work can help with that sort of clarity, can take the help from that sort of clarity key, so that you can have like concentrated efforts in that area, basically. So that's that. And third year, of course, is all about academics, is all about the theoretical aspect of your PG, is all about expanding your knowledge base of all the guidelines and whatnot that is there. But honestly, one thing that I did quite differently in MD as compared to MBBS, and I knew this right from the beginning, from the first day itself. I had thought really hard about it, and so I was not a great student in MBBS. I was I was always confused. I was not really academically very strong, not at all strong rather. I would just pass exams, mugging up like nights before, not sleeping, blah blah blah. I just knew that I didn't want that for myself here. I really wanted to learn the skills and be a good psychiatrist at the end of these 3 years. And I just knew that so there's this phrase going around the internet, right? Like academic comeback. I wanted this MDB to be that for me, because MBBS was definitely not the time where I fared really well in academics. So, and honestly, it is not just about what marks you get at the end of it. It's really not about that. It's really about whatever you learn in these 3 years, so I'm told, is the only time you'll actually really be opening the books. Because obviously you're forced to. You rows rounds पे someone will be asking you about something or the other, and they'll be grilling you with questions, and that's the only time when you'll actually study. And this is the only responsibility that you have at this point of time. Your responsibility is not to find a job or I don't know, grow more in your personal life. Your priority is doing completing this PG for the next 3 years. So yes, I tried for the most part that it is so. I just try that every day. I at least try to make an effort. I would tell you that, and by making an effort, I mean just opening a book and reading something. Honestly, it out of, let's say, if there were 100 days, I would only actually do something productive for 40 of them. But then other 60 days, I just focused on keeping my mind open to everything that was going around. So if there was a tutorial, if there was a seminar which was done by a friend of mine or some junior or anyone who would be, if I'm just sitting there and someone else is talking about something clinical or whatever, even nonsensical, I the only agenda was to keep an open mind, listen and be involved. And I can't tell you how many times I have learned about specific topics, specific ideas, not by ever looking into the book, but by only listening to those conversations. So I remember there was a time when we were doing our thesis protocol work, and one of my colleagues had her thesis on something called accommodation in OCD by family members. And it's something that I never read in any book after that. It's not a very commonly asked clinical question. It's not something that we regularly learn in our clinics, not really something we discuss regularly in our clinics. But it was something that I heard at that time, and fleeting. It was her thesis. She had some scales in it, and she had all that concept in it, which was far away from what I had my thesis about and everything. And during my final exams for a short case viva, I was actually asked about accommodation and the scales regarding it, and the only source of information that I had was from those conversations which I had heard in my first year, because that's when you do your thesis protocol, which kind of helped me go through those questions. So it's really important to keep an open mind in PG. You'll obviously fail more times to actually be able to do something productive, because I think first 6-7 months go about in really sort of understanding what it is, right? There is so much to learn. It's definitely new. It's definitely different from our traditional other medicines. It is a different type of theory. It's a different type of branch. So it does take a significant amount of time to get used to the content, but it's fine, honestly. Even if you take like an entire first year just kind of orienting yourself with it, getting your skills, becoming confident in interacting with people. So for me especially, I am someone who is not really very extroverted, so to say. I would never really be the person to strike a conversation. So I found it a bit difficult in the beginning to sort of have that be able to build a rapport with the patients. But that's something I think somehow I did not get anxious about, and therefore it took some time, but it did happen. But it's an important skill. So even if it takes like the entire first year to orient yourself with the material and get your clinical skills, obviously it's an ongoing process. But even to like the baseline level where you're comfortable talking with patients and you're comfortable, asking the awkward questions that you have to ask in a branch like psychiatry, it's fine. Even if your first year is dedicated to just that, it's really not a big deal. It's a good thing rather. And it's not a race. Some people will get there way before you do, and some people will take more time than you do. But that's fine, and yes, okay. One thing also is that this just reminds me, and I know I'll forget this, is that your co-PGs, your colleagues are all in it for the same thing, right? You're all there to complete your PG. You're all there with the same sort of material that you all have to learn and the similar kind of skills. But you'll be surprised how different everyone is with their pace, and how different they are with their baseline knowledge, and how different sort of backgrounds do they come from. And especially in psychiatry, there is a lot of role of the knowledge, general knowledge that you have, or the kind of life experiences that you've had, and they really influence the kind of physician or the kind of clinician that you become. So it's fine really that if people are starting at different points. Ultimately I did spend a lot of time comparing myself with people who I thought were doing much 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 better than me. And the thing is, by the end of 3 years I realized that it's really a race, it's really a competition from, like, with your past self. Because there is no way of knowing how, let's say I had like 6 co-PGs, how far along our experiences and how far along in our clinics were each one of us. So there was really no comparison there. There's really no point of any comparison there. That is something which I wish I'd learned earlier, because I did have some difficulties with that. A lot of self-criticism came along while comparing myself by a metric which other people were using. That's something. Another thing is that it does take a bit of a practice to get like a little hard skinned, because everybody, although everyone's there to teach you, but people will be constantly asking you questions. Your mentors, your guides, your teachers, your senior residents, your seniors would often be asking you a lot of questions, and that's like the kind of learning that we do in medicine. I don't necessarily agree with it. I don't necessarily see it as the best or the most effective way, but that's something that's quite prevalent in medicine, that you ask a lot of questions, and then you're supposed to come back with answers the next day and all of that. So you have to kind of get thick-skinned with the fact that there will be more times where you're not able to answer questions than there are times where you would be able to. And it doesn't work for everyone. Why I'm not really in for that approach is that it doesn't really work for everyone. It's not really effective for everyone, because not everyone, because if you're not answering questions, there is obviously some level of disappointment that comes with it from the other person. There is some level of judgment that, even if it is not coming from someone else, you might feel for yourself. So thankfully it worked for me, because I'm someone which really thrives on social validation. So it would push me if I would not know an answer, then I would go and read that up, and I would make sure that I'm never sort of I would take it very personally, and I would feel that okay, I felt an humiliation if I was not able to answer something, and I would go back and make sure that I don't ever not know this. But again, that also that helped me academically, but then personally again it was not the best approach, because I would be super critical even if I didn't know like a single thing or whatever. And again, that does, again, even for someone for whom it did work academically, it did have like a side effect to it. So there are definitely people who don't work well or who don't grow well under this sort of learning or teaching experience. But the thing is that this is the way people are taught in medicine. This is the way people are supposed to be learning in medicine, and it does take a while, especially because in PG, while in MBBS, like there are, if for in my batch in MBBS there were 200 more people other than me, so the spotlight never really goes on you unless you're like super extraordinary. But in a batch of like 7 co-PGs, the spotlight often does come on you, and often does come on everyone out of the 7 co-PGs. So there's no skipping that. But the thing is that you just have to get used to the spotlight and being put in positions where you suddenly have to answer and suddenly have to give your opinion and suddenly have to be quick on your feet, things like that. And then talking about one more important thing which I feel is less talked about is, so one is that yes, when you enter into PG, one thing I realized very late is how important the role of seniors is. You often get to know it only after they've left, because they'll always be the ones who would actually be correcting you. in the way that you want to be corrected, and in the way that you actually understand it. So they won't speak in jargons, they will give you like they see step by step of what it is that you did wrong, because often you'll get feedback which you won't even understand, and it's only them who would be able to break it down for you. And I can't even remember the number of times I've been saved um, by my seniors, and not just clinical but other situations as well. And but also what is really important is when you come to second year and when you have juniors of your own, how important it is to sort of send across the right messaging, and sort of be an authentic person, and an authentic senior who's like genuinely there for the people who are, let's say, 1 year junior to you. Because PG is bloody confusing. PG is or can often feel like a very very lonely place. So for me, I'm not someone who is able to build a lot of personal relations very quickly, but at least I think I try to do at least the job of being there professionally for my juniors. I don't know how good I was at that, but I think it's really important to not propagate the culture of what they say toxicity, and giving away your work to your juniors without ever recognizing how much they are getting, how much they have to do, just because you feel that you also did it when you were a junior yourself. So sort of having that state of mind and having that empathy for everyone who is working with you is something I'm sure I can always work more on it, but it is something to always think about, and I think I actively try to keep that in mind. Of course, there must have been times where I was not able to fully do this, and I'm sure a lot of people would disagree with me being successful at doing this, but at least we can all try to be the kind of seniors that we would have wanted when we were in those positions. Something like, I think needs to be a lot of kindness, especially in the medical community, something that we rarely have. But I think it's high time, because it's not a new fact that we're all overworked, we are overburdened, and we are just in a complete mess of states. And if only we could be good with each other, like nothing like it. I think we could be a self-sufficient community on our own. But okay, I have काफ़ी दूर चली गई मैं point से. One thing that a lot of people have asked me over the course of PG and even now is, does it take a toll on your mental health? Does it affect you personally when you are a psychiatry resident, or if you're practicing as a psychiatrist? Honestly, the answer is yes, it does. There's no way that you listen to people's stories, which are sometimes very overwhelming, and it doesn't get to you. It's not really possible. But the thing is that from very early on, and I think from even the day before you step into psychiatry, one has to go with the mindset that I have to find my way around it. Not, of course, at the risk of my own mental health, that's not what I'm trying to say, but then kind of strategize how I can let it not affect me in such a way that I'm not able to grow in this branch, or I'm not able to take care of my patients, or I'm not able to take care of myself. Thankfully, I feel it only took a toll on me sometimes when there were some stories of patients which were just extremely overwhelming, and mostly it does affect you if it hits something very personal, if it hits a point where you are able to relate with something in your life. And I think the only thing that made me go through that is sort of realizing that, okay, this person also went through something similar, this is emotional for me. But what is good about this is that I am not the only one who went through something like that. It's a very self-serving way of looking at things, but everyone has different ways of dealing with it. With that, of course, there are a lot of people who are not really able to look past this, who have experiences which with and encounters with patients which they're not able to get over. And also the fact that people often get stuck in the point that medicine as we experience during MBBS seems like a very technical and a very sort of black and white thing, which, mind you, even psychiatry is very technical, and there are like a hell lot of criteria, and there are a hell lot of ways and standards by which you diagnose and treat. But of course it is very subjective as well, it is very humane as well. And what happens is people often find themselves in this dilemma of I chose this as a medical branch, as a clinical branch, as something where I'll see patients, and what I'm doing doesn't really feel too clinical to me. It's a feeling that does go away for most people, because you realized how much of clinical work you're actually doing. Because what is clinical work, right? It's the time that you spend with the patients, the time that you spend in your clinical care, in your clinics, sitting with patients. And psychiatry gives you like the maximum amount of opportunity to stay with the patients. um, so the thing is, yes, for a lot of people it does get very overwhelming, and some people are fortunately able to look past it and grow out of it and learn to adjust their lives around it. But then of course there is a chunk of people who would still not be comfortable with the kind of work they are doing in psychiatry. I wish I had any sort of advice for them, but I'm really not the right person for it. But here comes a very important point, which I feel I don't know how much it would avoid this feeling of feeling extremely overwhelmed and feeling extremely emotional and feeling very broken down or having a mental breakdown. But I feel strongly, if psychiatry is something that you take by your own choice, it is something that it is a factor in making it quite easier, like many times easier than if you took it as a majburi. So it's for everything, right? You have to take a branch, or you have to decide on a career depending on whether or not you like it. That's true for everything, literally every career choice that you make. But it is specifically true for psychiatry, because it is not just the physical work, it's not just the hours of duties, it's not just the writing that you have to do, the extensive writing work that you have in psychiatry, but it is also a lot of mental work. So if one is not in it because they want it, it does get extremely difficult. So if there's like one piece of advice, anyone who's ever asked me as to why, like one advice of whether or not we should do psychiatry is, oh, I would say it is something for like sort of exclusively for people who either like it and they want it in the first place, or they think that there is a potential that they will eventually end up liking the branch. If you think that it is something that you'll never want to do, and there comes a point where you have to make a choice, rather make it would be honestly plainly simply better to sort of avoid it. Right, I don't really know what's the point of this video. And so now talking about like the exams that you work for the entire 3 years, the final exams, I think there has never been such an experience before in my life. I have gone through MBBS. There are so many exams that you give in that course, but nothing beats this, because it's so much. It's like 3 years worth of course material that you're tested on. There are like 4 theory exams, and then there's this one day of practical. Honest to God, theory does go by pretty easily as compared to how difficult your practical exam is. Full disclaimer, my practical exam went on. I reached the center at 7:30, and I walked out of it at 9 p.m. So 7:30 a.m. to 9 p.m. is the amount of time it took for the examiners to test us on our clinical skills. There's something called a long case viva that happens on a practical day, in which like it is so dramatic. So there are like 6 examiners sitting in front of you across the table, and you're on the other side of the table and you're presenting a case, and that viva goes on for 45 bloody minutes. For me at least it was 46 or 47 minutes. And the questions just don't stop. And it is, they only test you on skills which you have acquired over the past 3 years, something that you do every day, but it still feels like nothing prepares you for it. But in hindsight, the only thing that does prepare you for it is honestly working on those clinical skills and seeing patients, as many patients as you can. Then there are like multiple vivas. I think I gave 5-6 vivas that day. There's a lot of waiting involved. You lose your appetite, you lose a lot of hair preparing for the exam, you lose a lot of self-esteem here and there. You keep building it up, you keep trying to believe in yourself, but then of course everyone, even like the psychiatry PGs, have mental breakdowns, and there's a shit ton of anxiety. But honestly, after you give it, after your I remember after my exam was over, my practical exam, I slept like a baby for, I think, till 1 p.m. the next day. And I was just numb for the next 2 days. Like, everybody else was congratulating me for how it was over, but I was just numb. I could not really fathom what had happened. And when that feeling sort of sinks in, you realize that there is really no other exam, there's really no other sort of achievement, at least till now, which matches up to this. Like, there's nothing else that I'll ever do academically, or I have ever done academically or professionally, which would match up to this feeling of this exam, giving those vivas, long case viva, short case viva, neurology viva, grand viva, falana viva, dhimka viva, and sort of getting out of that hospital and coming out at 9 p.m. and your parents are wondering what the hell took you so long, and how can it go on for like more than 12 hours, and you put like 3 years from the first day you enter. You know that there is going to be an exam at the end. You'll be tested on whatever you learn for the next 3 years on this, and all of that mehnat that you do, little bit of mehnat that you do every day for like preceding 3 years, only like mounts up for that one day of practical exam. It's a bloody high pressure situation, but okay, you do it just it is something that I still do not have a lot of words to describe for. But yeah, and then comes your result. For me, it came pretty early. I think in 10 days we had our result. That's another feeling. But I think I was not as happy as I was when I saw the result as I was after my practical exams, because the burden of that getting over is far, far more satisfactory than getting your result. At least in my case, it was. So yeah, it was 11th of Feb this year when I got my result, and I got to know that woohoo, I'm a psychiatrist now. And what next? So I've obviously been looking for jobs. It's been a month now. I have gotten somewhere into that job search, but honestly, after exams, it's just a lot of clerical work that you have to do, a lot of documentation that you have to get verified and rectified. You have to run behind a lot of people, so that's what I've been doing. And on a very personal, interesting note, throughout this PG journey, like I said, in second year, you do a lot of exploring. On exploring, I found a lot of interest in something called as health education, mental health literacy, mental hygiene. And I always knew that I wanted to be somewhere making action, doing something about it. So your girl has started something called as the Vriddhi Foundation. Vriddhi means growth, for anyone who doesn't know. It is born out of the idea that I feel it is extremely important, as important as education is, for everyone to be educated on topics of mental health. Because, as I mentioned, the biopsychosocial model, mental health does affect not just an individual but entire communities, and not just health but economics and development and whatnot, and social justice, and it has far reaching implications. So Vriddhi Foundation has a YouTube channel which I would link below. I'm trying to put out content related to mental health as much as possible there, trying to make it a regular thing. And we have started workshops, especially currently focusing mostly on adolescents and young children, talking about skill development, talking about emotional literacy, introducing concepts of mental health, crisis management, also planning to give gatekeeper trainings to whoever, teachers, parents, um, anyone who is involved with any sort of human being, something which, and trying to find solutions which are accessible, affordable, and sort of scalable, with the vision that someday we're able to provide basic literacy to basic mental health literacy to as many people as we genuinely can, and bettering their outcomes, um, and bringing people in need to mental health facilities faster, identifying people at risk, and all of that. uh, it's still a work in progress. It is still very fresh, very new. I'm also still finding what exactly it is that I want to do with it. But yeah, that is something I have started. I don't know how it goes, but I do wish and I hope it is able to make some impact, especially in the mental health space. So, yeah, if you have any other questions for psychiatry, PG, medicine, anything else, Vriddhi, drop them in the comments below. Thank you so much for listening to this. If you have reached this far in the video, thank you. Bye.